I'm Larissa from Your Horse magazine, and we're here today at Fellows Farm Equine Clinic in Cambridgeshire, trying to learn what it takes to be an equine vet. I'm here with David Rutherford. Hi, David.
Hi, nice to meet you.
Thank you so much for having us today. Could you just talk us through some of the cases that we've seen this afternoon?
This afternoon we had a 18-month-old miniature Shetland. And over the last month or so he's developed a slight outward turn of his lower leg. So it turns outwards on both legs from the sort of knee joint. There are surgeries that can correct this sort of thing, but at the moment I feel that his case is reasonably mild, and I want to spend about a month doing sort of more conservative treatments. We have rasped down the outside of his hoof on both sides to try and help him sort of his legs tilt outwards again, and we've asked his farrier to either apply a stick-on shoe which has an inside lengthening effect, or alternatively he might build up the inside of his foot with an acrylic. Do that for about a month and see whether his legs have started to straighten at all. If they haven't, then as I say, there are surgical procedures that could be done. He's not suffering, his legs are not in a terrible way, but over the next 2-3 months that's our sort of only opportunity to try and correct his and get straight legs for what might be a sort of 35-40 year life. We had a thoroughbred foal come in. Well, she's 6 months old now, which is suffering from a abdominal infection. She's come in here to be hospitalised for a week. She had a catheter put in her neck vein so that we can give her intravenous medicines. So we want her here so we can give her medicines and hit her infection quite hard at the beginning. She's doing pretty well. This afternoon we had an emergency admission. It's a horse that was first seen for colic last night. Apparently this morning he started pawing the ground and colicking again, but because it sort of persisted for more than kind of 12 hours, he was referred into the clinic. So when he got here, he was reasonably comfortable and bright. He wasn't showing obvious colic signs. His heart rate was reasonably low, it was sort of 36. He had decent gut sounds. His temperature was normal. I gave him a muscle relaxant again and did a rectal exam, so I had a good feel around the inside, and that was all pretty normal. And then I did an ultrasound scan of his abdomen, and again that was pretty normal. And then we've done a general blood profile as well, looking at kidney and liver enzymes and signs whether he's got any infections and things, and again that's all pretty normal. So he, at the moment we don't have a specific diagnosis for. We'll be keeping him in the hospital and monitoring him basically. And then the last one this afternoon is a horse that was in the hospital that had a kissing spine surgery 2 days ago. So he's just in to have his medicines and stuff and make sure he's comfortable after the operation. He's doing really well, and this afternoon he had his teeth done. So every horse needs its teeth rasping from time to time. I mainly use the motorised equipment because it's very effective and quick and easy, and takes the sharp edges down very easily. And then I sort of finished off a little bit at the back with a hand rasp. He'll be fine for another year now. He's got nice smooth teeth, and we'll just say next year, same sort of time, to do the job again.